Okay, let's dive in. Today we're tackling a topic that, um, well, it can feel incredibly personal and intense. Panic attacks.
Yeah, definitely.
But it's also something surprisingly common. Maybe you've experienced one, maybe someone you care about has, or perhaps you're just trying to figure out what they even are.
It's one of those things, isn't it? Often talked about, but maybe not always fully understood from all the different angles.
Exactly.
So our mission here really is to pull together everything you've shared with us, the clinical definitions, those really raw personal stories, the science bit, even how artists try to capture this kind of internal storm.
Yeah, give you a really complete picture. We've got the research, the firsthand accounts,
Yeah.
thoughts from writers, performers, all sorts.
Mm-hmm.
We're going to unpack what a panic attack means clinically,
Mm-hmm.
what it actually feels like, you know, subjectively, how it can impact your life.
The possible reasons behind them, what helps people cope and recover.
And that really fascinating challenge is trying to show this deeply internal thing to the outside world.
Right. So let's jump right in.
Okay.
So first things first, I think it's crucial to ground ourselves in the clinical view. Like, what is a panic attack according to the expert?
Right. The official definition.
Yeah. The DSM-5, that's the standard diagnostic manual. It defines it as an abrupt surge of intense fear or intense discomfort.
Abrupt. So sudden.
Exactly. Hits fast and reaches a peak within minutes. That's key.
Okay. And during that peak, there's like a checklist of symptoms, isn't there? You need a certain number to count.
That's right. 4 or more specific symptoms have to occur during that intense peak period. It's how clinicians differentiate it, you know?
So what kind of things are on that list?
Well, a lot of it is very physical. Palpitations, a pounding heart, or just a really accelerated heart rate.
Yeah, I've heard that one a lot.
Sweating, trembling, or shaking, that awful feeling of shortness of breath or like you're smothering.
Ugh, like you can't get enough air in. Or even choking.
Feeling of choking. Plus, chest pain or discomfort, which really fuels the heart attack fear we'll talk about. Nausea, stomach trouble.
Dizziness.
Feeling dizzy, yeah, unsteady, lightheaded, or even faint.
Wow.
Then there are other bodily sensations, chills, or feeling suddenly hot heat sensations, and something called paresthesias.
What now?
Paresthesias. It's basically numbness or tingling sensations, like pins and needles, often in your hands or feet.
Okay, got it. And then there's the mental side, which sounds just as intense.
Oh, absolutely. Things like derealization, where the world around you feels suddenly strange, unreal, distant.
Like you're in a dream or something.
Kind of. Or depersonalization, that's feeling detached from yourself, like you're outside your body watching things happen to you.
Whoa.
And then the really big ones, the core fears that often come with it. The fear of losing control, the fear of going crazy.
And the fear of dying. That seems huge.
It's often overwhelming, that immediate conviction that you are dying right now.
Okay, so that's the clinical checklist.
Yeah.
But there's a really important point here, isn't there? Something vital for people to know if they experience this.
Yes, absolutely crucial. As utterly terrifying as all those symptoms are, and believe me, they feel real and incredibly dangerous, often sending people straight to the ER thinking it's a heart attack.
Right.
The sources are very clear on this. Panic attacks themselves, while profoundly distressing, are not physically dangerous or life-threatening in that moment.
That's huge. Hard to believe when you're in it, I imagine, but huge.
Incredibly hard to remember, yes, but vital knowledge. Still, that clinical checklist, while useful for diagnosis, doesn't quite capture the lived experience.
Right, the raw feeling of it.
Exactly. So let's move from that objective definition to the subjective reality. What do these attacks feel like to the people going through them?
This is where those personal accounts we looked at are just so powerful, aren't they? They paint a much richer picture.
Definitely.
One description that really stood out was feeling like electricity traveling up through my legs. That's so specific and unexpected.
It really shows the variety, doesn't it? But many descriptions focus on that desperate struggle for breath, hard to breathe, suffocating. Air was not getting in.
Or just drowning. Such a powerful word for it.
And the sheer terror. Accounts talk about an immediate feeling of complete and utter terror, believing without a doubt they were dying.
Can you even imagine someone mentioned checking their pulse and finding it very faint? That would just ramp up the fear, wouldn't it?
Oh, absolutely. Instant feedback loop. And the physical intensity isn't just internal feelings. People talk about a pounding heart they can hear.
Like hearing it through my ear onto the pillow?
Yeah.
Wow.
Yeah. Profuse, sweating, shaking uncontrollably, maybe even jumping out of bed from the surge, feeling completely wired.
And it messes with your head, too, not just the fear. Someone described their mind becoming hazed, as if there's a thick fog setting in.
Yeah. Thoughts scattering, difficulty concentrating. That feeling of being physically trapped or crushed comes up too.
Like the world around me is closing in, or being trapped in a tiny box that is shrinking and crushing me. Yikes.
Or that weird contradictory feeling, lightheaded at the same time as being bolted to the spot, dizzy but stuck.
One description tried to capture that paradox. Like,
Yeah.
I'm being crushed, pulled apart, held in place, and thrown into the air all at the same time. Just absolute chaos.
Some descriptions use almost like metaphysical language to convey the horror.
Like I'm dying and being dragged to hell by 1,000 demons.
Yeah, or something more visceral like, there's a little demon inside me that wakes up claws around my insides. Just this internal torment.
And the physical details can get really strange too, right? Eyeballs vibrating, a rushing sound in the ears, tunnel vision.
Mm-hmm. That feeling of needing to just crumple and hit whatever is in my way. Or legs feeling light, vision blurring. It's a total system overload.
One concept that came up in several accounts, which I found fascinating, was this idea of dual threading.
Ah, yes, that's a really interesting one.
The idea that you can be deep in this irrational panic, convinced you're dying, while also having a part of your brain rationally aware, thinking, okay, this is a panic attack, I'm probably not actually dying.
That split consciousness, it speaks volumes about the complexity, doesn't it? Being both the terrified experiencer and the somewhat detached observer at the same time.
Totally. And you mentioned the variety. Not everyone gets the same symptoms, and how it shows up externally can differ too, like fight, flight, or freeze.
Exactly. Some people might feel that intense urge to escape, to run, that's the flight. Others might become agitated or irritable, maybe the fight response. And some just freeze, tense up, unable to move. It manifests differently.
Okay, so we have the clinical definition, the intense subjective feeling. How does experiencing these attacks sometimes turn into a diagnosable condition?
Right, that's the transition from having, say, an isolated panic attack, maybe triggered by extreme stress, to having panic disorder.
What's the key difference there?
The key insight from the sources is that panic disorder isn't just about having the attacks. It's about what happens afterwards. The fear of the attacks.
Ah, the anticipation.
Precisely. The DSM-5 criteria need those recurrent, often unexpected panic attacks, plus at least 1 month of something else significant going on because of them.
And that something else is?
It's one of two things. Either persistent concern or worry about having more attacks, or worrying about their consequences, like, what if I lose control? What if I have a heart attack for real next time? What if people see me?
Okay, so constant worry.
Or a significant maladaptive change in behavior specifically designed to avoid having panic attacks.
Right, you start changing your life to prevent them.
Exactly. You start limiting where you go, what you do, who you see, all driven by that fear of triggering another one.
The case study of Dave you mentioned really brings this to life.
Yeah, he's a great example from the sources. 41-year-old guy ends up in the ER thinking he can't breathe, heart's going crazy.
But medically, he's okay.
Medically, they find nothing wrong. But he keeps having these episodes, intense fear. Peaking fast, sweating, palpitations, chest pain, shortness of breath. And crucially, he's terrified of dying during them.
And that fear starts controlling him.
Totally. The sources show he becomes consumed by worry about the next attack. So he starts avoiding things. Unfamiliar places, crowds, situations where he feels like escape might be hard if panic hits.
So his world starts to shrink.
Drastically. He avoids social events, stays home more, even relies on his wife to drive the kids. Which, understandably, puts a strain on the relationship too, because the fear driving the avoidance can seem irrational to others.
Yeah, I can see that. So his story really shows how the attacks, plus the persistent worry and avoidance, lead to that panic disorder diagnosis.
Exactly. And this avoidance behavior often ties directly into another condition that frequently goes hand in hand with panic disorder, agoraphobia.
Right, you mentioned that. How does that fit in?
Agoraphobia, at its core, is often described as a fear of situations where escape might be difficult or help might not be available if you were to have panic-like symptoms or a full-blown panic attack.
So it's not necessarily fear of, say, open spaces themselves, but fear of panicking in an open space.
That's often the driving force, yes.
Right.
It's the fear of the panic attack and its consequences in specific contexts. And that fear leads to avoiding those situations.
Like what kind of situations?
Things like public transport, being in open spaces like parking lots, or enclosed spaces like shops or cinemas, standing in line, being in a crowd, or even just being outside the home alone.
Wow, that can really limit your life.
Hugely. In severe cases, it can lead to people becoming essentially housebound. The sources even mention hikikomori in Japan, that phenomenon of extreme social withdrawal, as sometimes being linked to severe agoraphobia and anxiety.
It sounds like a really tough cycle to break. Okay, we've covered the what, the feel, the impact. Let's get into the big question, why? Why do panic attacks happen? What causes them?
Well, the sources are pretty clear that it's rarely just one thing. It's usually a combination of different factors coming together.
Like a perfect storm situation.
Sort of. There can be biological factors involved. Sometimes other psychiatric conditions like PTSD or OCD might make someone more susceptible. Certain medical conditions, too, things like heart issues, low blood pressure, and overactive thyroid need to be ruled out.
Yeah.
And there's evidence pointing to imbalances in certain brain systems, particularly the norepinephrine system, that's heavily involved in our fight or flight response.
So the body's alarm system might be like overly sensitive or misfiring?
That's one leading idea, yes.
Yeah.
Then you layer on psychological and environmental factors.
Stress.
Big time. Significant life stress, major losses like a relationship ending, big transitions, new job, moving house, or even just that slow burn of cumulative ongoing stress can all contribute.
Does personality play a part?
It seems to. Certain traits might increase vulnerability. Things like being prone to excessive worry, needing a lot of reassurance, having a generally anxious outlook, being overly cautious.
And what about substances? You hear about caffeine sometimes.
Definitely. Nicotine, caffeine, even cannabis use or withdrawal from these substances are mentioned as potential triggers or things that can make panic symptoms worse for some people.
And is there a genetic link? Does it run in families?
There's evidence suggesting a genetic component, yeah. Twin studies point towards some heritability, so if you have a family history, your risk might be slightly higher, but it's definitely not destiny.
It really sounds like a complex mix. Dr. Lane Ryan, who shared her personal story in the sources, she really felt that reflected her experience. She didn't pinpoint one cause, but saw it as this combination of stress. She mentioned a breakup, work pressure, a family illness, all hitting around the same time,
Right.
layered on top of her own, habitual way of being. She described herself as an anxious child, a worrier. It was that convergence.
That makes a lot of sense. And the deeper scientific dive into the brain, the pathophysiology, also points to complex interactions.
Like what?
Well, theories focus on dysfunction in what's called the brain's fear network. Areas like the amygdala, which is like our threat detector.
So the part that yells danger might be malfunctioning.
Potentially, or maybe it's overreacting. One really interesting theory suggests the amygdala might become hypersensitive to subtle internal bodily cues,
Like what sort of cues?
like tiny shifts in the brain's acid-base balance, which can be linked to carbon dioxide levels.
Cute from breathing.
Exactly, which might help explain why certain breathing techniques, which influence CO2 levels, can sometimes help manage panic symptoms.
Wow, that's fascinating, linking brain chemistry changes from breathing to this intense fear response.
It is, isn't it?
Yeah.
Other ideas involve the amygdala being generally hyperactive or perhaps having less inhibition from other brain areas that normally calm it down. This could potentially be linked to things like childhood adversity or genetic factors. And then there are the neurotransmitters, the brain's chemical messengers. Imbalances in serotonin, GABA, which usually calms things down, norepinephrine, the alert chemical, glutamate. These are all implicated in anxiety and fear regulation.
So lots of potential biological mechanisms. And you mentioned a cardiac mechanism theory, too.
Yes, that specifically tries to explain the chest pain symptom, which is so common and frightening.
Right.
The idea is that the intense stress response during a panic attack can actually affect blood flow in the coronary arteries, causing real physical pain that mimics cardiac symptoms.
Which would absolutely convince you it's a heart attack.
Precisely. It creates this vicious feedback loop. The pain fuels the fear worsens the panic, which might sustain the physical symptoms. It also really underscores why getting checked out medically first is so important to rule out actual heart problems.
Okay, this is incredibly complex. We've talked about what it is, how it feels, the impact, the potential whys. Let's talk about the path forward. How do people manage this? How do they get better?
Right. The good news, and the sources really emphasize this, is that panic attacks and panic disorder are highly treatable.
That's reassuring. So what's the first step?
Usually it starts with a clinical diagnosis. Seeing a doctor to rule out any underlying medical conditions is key. Then, often, consulting with a mental health professional, a psychologist, psychiatrist, therapist.
And what are the main treatment approaches that work?
It's often a combination of therapy and sometimes medication. Cognitive behavioral therapy, CBT, comes up again and again as being very effective for panic.
How does CBT help with panic specifically?
Well, a big part is cognitive restructuring. That means learning to identify those catastrophic thoughts that pop up during panic. I'm dying, I'm losing my mind, I'm going to suffocate, and actively challenging them.
How do you challenge them?
By examining the evidence, looking at them realistically based on what you now understand about panic attacks, that they feel awful but aren't actually dangerous, and replacing them with more balanced coping thoughts like, this feels scary, but it's a panic attack, it will pass.
So kind of retraining your brain's automatic fear response.
Exactly. And another key part of CBT, especially if avoidance or agoraphobia is involved, is exposure therapy.
That sounds scary in itself.
It can feel daunting, yes, but it's done very gradually and safely with a therapist's guidance. The idea is to slowly confront the situations, places, or even the physical sensations like rapid heartbeat that you've been avoiding because of the fear of panic.
And the goal is?
The goal is to learn through experience that you can handle the anxiety, that the feared catastrophe doesn't happen, or that you can cope even if you do feel anxious. It helps break that cycle of fear and avoidance.
Makes sense. What about medication? What do the sources say there?
Medications can be helpful, often alongside therapy.
Mhm.
SSRIs, those are selective serotonin reuptake inhibitors. Common antidepressants are often considered a first-line treatment.
Okay.
Other types like SNRIs, TCAs, MAOIs might be used if SSRIs don't work well. And then there are benzodiazepines.
Like Xanax or Valium.
Right. They can provide very quick relief during an acute attack, which can feel like a lifesaver. But the sources strongly caution about the risks of dependence and tolerance with long-term use.
So they're usually more for short-term or occasional use.
Generally, yes. Or while waiting for longer-term treatments like SSRIs or therapy to kick in. The overall goal with medication is often to get symptoms under control and then, ideally, taper off gradually, especially if therapy is effective.
Beyond the clinical stuff, are there lifestyle changes or self-help strategies that people find useful?
Definitely. Exercise is often recommended, particularly aerobic exercise. It can help manage overall anxiety.
Though, wait, wouldn't an increased heart rate from exercise potentially trigger panic?
That's a really important point. And yes, it can for some people initially. So it's about finding the right type and intensity, maybe starting slow and understanding that the sensation is from exercise, not danger. But overall, regular exercise seems beneficial.
Okay, what else?
Avoiding or reducing substances that can trigger or worsen anxiety is often key. So, caffeine, nicotine, cannabis for some people.
Right, the usual suspects.
Yeah. Relaxation techniques like meditation or progressive muscle relaxation can be helpful for general stress management, though some research suggests maybe they're less specifically effective for panic attacks themselves compared to, say, CBT's exposure component. But they can still be part of a toolkit.
And breathing exercises, you hear about those a lot.
Yes, they come up frequently. Not the old advice of hyperventilating into a paper bag, though.
No, why not?
Well, the idea was to rebreathe CO2, but it can actually make things worse for some or isn't addressing the core issue. The focus now is more on slow, diaphragmatic breathing, deep belly breathing to help calm the nervous system and potentially regulate that oxygen-CO2 balance we mentioned earlier. Measured, controlled breathing.
Got it. And Dr. Ryan's recovery story, what were her main takeaways from her own journey?
Her perspective was really insightful. She emphasized that recovery wasn't about finding a magic cure or winning some kind of battle instantly.
More of a process.
Very much a process. For her, it involved making gradual but consistent changes in how she responded to stress and worry in her life. A huge piece was education, learning everything she could about panic.
Knowledge is power kind of thing.
Absolutely.
Yeah.
Understanding the physiology, the triggers, why it felt so awful but wasn't actually dangerous. She said that knowledge itself significantly reduced the fear's grip.
That makes sense.
She also talked about self-help strategies and, importantly, finding a sense of acceptance. Not resignation, but less fighting against the experience and more focusing on managing her responses to it.
And she said it changed her work.
Yeah, she felt that going through it herself profoundly changed her as a psychologist. It gave her a deeper empathy and understanding, allowing her to connect with and help her clients much more effectively.
That's really powerful. Turning a difficult experience into something that helps others. Okay, so we've covered the clinical side, the personal feel, the causes, the recovery paths. Now, for something a bit different but really intriguing, how do you even show this? How do you portray something so intensely internal, like panic, in art or media?
That's a huge challenge, isn't it? The sources touched on this, especially from theater and writing perspectives.
Hmm.
How do you make something that feels like electricity or fog or demons visible or understandable to an audience?
What were some of the early approaches mentioned, say, in theater?
Well, initially, directors might lean on external effects, jarring soundscapes, maybe actors doing lots of rapid, shallow breathing, or even wailing sounds, flashing lights, stage rumbles, trying to create sensory chaos to mimic the internal state.
But there were issues with that.
Yeah, feedback highlighted a couple of things. For actors, repeatedly performing such intense distress can be incredibly draining, even potentially re-traumatizing if they have their own experiences. It really underscored the need for good support systems and like de-rolling or de-stressing practices after rehearsals or performances.
Makes sense. So what alternatives came up?
People started exploring different artistic routes, maybe using more abstract movement pieces on stage to convey the feeling of panic physically without literally acting out specific symptoms like gasping.
Interesting.
A really key insight for actors and directors was the idea of playing the action, not the emotion.
What does that mean?
Instead of trying to act panicked, focus on showing the character trying to do something simple, an everyday task, but being completely derailed by their internal state.
Oh, right. Like trying to pour coffee, but their hands are shaking too much? Or trying to put on a coat, but they're too distracted or fumbling?
Exactly. Showing the impact of the panic on their ability to function. Or showing characters desperately trying to hide it, to appear normal, but the panic keeps sort of leaking out, cracks in the facade.
Yeah, that sounds really effective.
Or depicting those specific, sometimes seemingly irrational actions people take when anxious, frantically packing a bag for no reason, or desperately searching for their phone. And remembering to show the variety, someone might freeze up completely, another might pace restlessly.
And what about for writers? How do you get that internal chaos onto the page?
That's a tough one, too. Writers talked about using sentence structure, maybe very short, fragmented sentences to mimic shortness of breath or scattered thoughts.
Or the opposite, like a
What?
long run-on stream of consciousness?
Exactly, yeah, to capture that overwhelming flood of internal noise, maybe that dual threading. We talked about the panic and the rational awareness clashing, playing with format, punctuation, internal monologue.
The sources mentioned a recent example from animation. Inside Out 2.
That film made an explicit attempt to visualize an anxiety or panic attack from the inside, showing the anxiety character literally overwhelming the control console, pushing other emotions away.
And linking that internal visual to the external signs.
Yes, showing the character Riley exhibiting the physical symptoms like heavy breathing, crying, while we see the chaos inside her mind headquarters. The director apparently drew on personal experience, aiming for authenticity.
It really highlights how tricky it is, though, doesn't it? To translate such a subjective internal state into something visual or verbal that resonates.
It absolutely does. It's a constant challenge for artists. How do you bridge that gap between internal feeling and external representation so an audience can connect and understand, even if they haven't felt it themselves?
So let's bring this all together. Thinking about everything we've discussed, what's the overall outlook for someone dealing with panic attacks?
The main takeaway, really, has to be one of hope. Despite how incredibly scary they feel, remember that core message. Panic attacks are not physically dangerous in the moment.
But, and this is the important but, if they're happening repeatedly, if they're making you constantly worried, if they're causing you to avoid things and change your life,
Then seeking help is really crucial. The sources emphasize that untreated panic attacks can sometimes progress and lead to more entrenched conditions, like panic disorder or significant agoraphobia, which can be much harder to manage down the line.
but with help.
With effective treatment therapy like CBT, maybe medication, lifestyle adjustments, learning coping strategies, the prognosis is generally very good. Symptoms often improve significantly, sometimes even resolve completely, often within weeks or months of starting treatment.
And echoing Dr. Ryan's experience again. It really can happen to anyone. There's no shame in it.
Absolutely none. And it is something you can overcome or at least learn to manage effectively by making changes, seeking support, and as we've seen today, by understanding what's actually going on.
Yeah, this deep dive really shows that understanding panic attacks means looking through so many different lenses, doesn't it?
The clinical definition gives us a framework, but the personal stories give it weight and reality. Then there's the science trying to figure out the why, the practical steps towards recovery.
And even thinking about how we try to share these experiences through art.
Bringing all that knowledge together, the science, the lived experience, the treatment approaches, it's just such a powerful way to get a handle on something this complex.
So a final thought for you listening. Given how deeply personal and varied panic feels, and how difficult artists find it to truly capture that inner world, what does this whole exploration tell you about the limits, maybe, but also the possibilities of really understanding what someone else is going through internally? What's the one thing from all these different perspectives that stands out most for you?